So now I want to get as many of your calls to West Streeting as possible. Peter, hi.
Hello, hi Wes.
Hello.
I'm glad you made the point about the lack of GPs. I'm a semi-retired GP. I'm seeing it on a regular basis that practices are unable to fill vacancies, and the pressure of work on general practitioners is intolerable. And even worse is the fact that politicians often hold them to blame and try to introduce reforms that are punitive to the GPs themselves. Now, to my mind, one of the main reasons why we have an increasing shortage of doctors is the loss of free movement of doctors from the European Union. And of course, when Brexit happened, there was no obligation on the government to end free movement. It's been severely damaging on both sides. And unfortunately, all Labour is telling us in response to this shortage is they're going to train up more doctors. Now, if you open a medical school soon after you come into office, you're going to have people coming on stream in the second half of the 2030s, because that's how long it takes to train. It's no substitute for actually dealing with the problem we have today. And importing doctors from developing countries is punitive to those countries. I mean, they can't afford to lose their essential medical workforce, or indeed their nurses. So I'm putting it to you that what Labour needs to do is to recognise the profound mistake of ending free movement, regardless of what you think about Brexit. And when they have the chance to renegotiate in the first 2 years in office, and they will, that should be on the agenda.
Bringing back free movement for doctors? Or for health workers?
I was about to say, I don't think we need to return to freedom of movement to solve this particular problem. We do actually recruit more NHS staff from overseas than we are training here at home increasingly, which is why we have emphasised training. And I make no apologies that I absolutely recognise what Peter's just said about the length of time it takes to train a doctor.
And the bottleneck at the end.
But that's why, I mean, I sometimes find this a bit ironic, and this is a big thing that comes from the profession, is stop talking about recruitment, focus on retention. And of course retention is important, but I'd say it's not an either or.
Both matter.
And actually, what I find extraordinary is, often I think politics and politicians are too short-termist, and I sort of sometimes...
We agree with you.
And I say, and I sometimes roll my eyes, the irony that I sometimes get from the profession, and I do understand why, so I'm not having a go, but I just think, please don't ask politicians like me to be more short-termist. That's the problem. At least I've got a fundamental workforce plan for the long term that will get the NHS the staff that needs to treat patients on time.
So
but we do need to deal with that bottleneck.
You bring on stream more young doctors. Yep. They get trained for the sake of argument 7-8 years. They want to become a specialist in blah.
Yeah.
What will you do? Create posts in trusts and make sure that where there were 3, there are now 6?
Well, yeah, we think for the longer term, our commitment is to make sure that as we're bringing new people through medical school, which is extremely expensive, by the way, and ours is a fully costed, fully funded plan, but it's expensive for the taxpayer and it's expensive for the students. We've got to make sure there are jobs for them to go to, and the NHS needs those jobs. I think what would help now, because the NHS has done the analysis, is if the government published the work, published the numbers, showed us where the bottlenecks are, and opened up.
Well, the health
more
service is telling you
routes.
where they are.
And exactly, and it's and I feel really sorry for NHS leaders. Actually, I really do, because they're stuck in a rock and a hard place. They're giving their political masters the evidence, the detailed technical work they need to make decisions. And the government just aren't moving. And against the backdrop of the longest waiting lists and longest waiting times and lowest patient satisfaction in the history of the NHS, I find that inertia baffling, but I also think it is, for patients, a terrible betrayal, and for the NHS leadership and NHS workforce, it is also, I think, a big kick in the gut.
Right, well, we'll get more calls in just a moment. I hope that answered your question, Peter, either in part or in full. Thanks very much indeed for your call. More of them after the news headlines. It's 2:32. Holly Harris has an update.
Labour's